Good evening, good evening, good evening. Gandang gabi, good evening. Gandang gabi sa lahat. Hindi ako makatulog. Kaya magbabasa na lang ako. Siguro hindi ako makatulog kasi hindi pa ako nakapagbasa. Pero once makapagbasa na ako, makakatulog na ako nito. Vaginal and urinary health. Although the vaginal and the urinary tract are not directly connected, their proximity means that trouble with one can rebound on the other. As every pregnant woman knows, for instance, a swelling uterus puts a good deal of pressure on the bladder. It is also the same set of muscles that hold both bladder and uterus in place. So, as weakness here will affect both. An, an anatomical guide. Understanding the processes taking place in your vaginal and urinary system is important for maintaining the health of these areas. Below, urine is produced by our kidneys and passes via the ureters into the bladder. When this is full, the urine is released down the urethra and out of the body. To control where and when we do this, the brain receives a message that our bladder needs emptying, and we can, to a greater or lesser extent, use muscles to temporarily stop urine from being released. The uterus sits just above and behind the bladder and is similarly connected to the outside world by the vagina. The vagina is about 8 cm long and lined with strong but involuntary muscles. This can only be controlled at will with a specific training. The vagina is kept lubricated by secretion from the cervix. In additional lubrication during sexual stimulation is supplied by small glands. That gland is Bartholin's. Bartholin's glands. Bartholin's gland. Near the vagina entrance. See the picture. This is what it looks like. Hindi siya kita. Yan. It's clear. Kidney, ureter. Problems. Both the urethra and the vagina are vulnerable to irritation and infection because they connect directly with the outside world and provide the sort of warm dampness that bacteria and fungi prefer. However, they have built-in mechanism to offset this vulnerability. The urethra is protected by urine itself, which is sterile, and provided there is a good flow, helps flush out anything unwanted, acting much like an internal douche. The vagina, at least during a woman's reproductive years, constantly shades layers of lining to keep itself fresh and maintains a specific pH, acid and over alkaline, balance that inhibits pathogenic bacteria or fungal growth. It is when this mechanism go wrong that most problems occur. It is sensible to treat them as soon as possible, not only because they are irritating and highly uncomfortable, but because left untreated, they can spread upwards and cause greater problems to other organs, such as the kidneys or ovaries. Cystitis. 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 This is inflammation of the urinary tract, often because of an infection. It is characterized by an urgent need to pass water frequently, even when your bladder is not full, and a burning or stinging sensation while doing so. It can be accompanied by pain above the pubic region, headaches, and nausea, and can develop into a low-grade fever, especially in the late afternoon. Shakes and chills, and general weakness and body ache. Cloudy and smelly urine should confirm the diagnosis. Cystitis is very common. About 50% of women have experienced an attack at some time. And for many women, it becomes a recurrent problem. It can be kick-started by anything that irritates your urethra, and a particular sensitivity may set off time and again. Wearing synthetic or non-absorbent underwear, internal abrasion caused by energetic sex, or an activity such as horse riding, contact with perfume bath oils or talc, or chlorine in swimming pools, and oral sex can all be culprits. Honeymoon cystitis is quite common and is caused by bruising around the urethra as a result of over enthusiastic lovemaking. Even urine itself can be responsible if it is either over acidic or too concentrated from drinking too few fluid. Pelvic floor exercises. The various organs of the lower part of the abdomen are held in place by pelvic muscles and ligaments that lie in hammock like fashion from front to back. Keeping this support well toned and strong helps bladder control, muscular control during sexual intercourse, and reduce the risk of prolapse. Exercising the pelvic floor can be done at almost any time and is discreet enough even to be done in public. Aim to do it often, about once an hour. There are several variant exercises, but you could try the following. Push down as if you were trying to go to the toilet. Push down as if you were trying to go to the toilet. Hold for 5 seconds and then pull in the opposite direction as if you were trying to suck your rectum off into your stomach. Hold for 5 seconds. Repeat 4 or 5 times. That is the pelvic exercises. So, tomorrow ulit. At least nakapagbasa ako. Nakakatulog na ako nito. Good night, everyone. Bye-bye. God bless. And always keep safe and pray. God bless. Bye-bye.